Hey, Mark from CASEMCQ, the Center for Access to Services in English, Mauricie, Centre du Québec. If you haven't checked our website, or if you're not one of our friends on Facebook, time to do it right now. Health, the human body is an incredible, extraordinary machine, and a lot of different people are specialized to take care of it or to help us take care of it. So I was looking around to know all about all the different specialists, and I found a physiotherapist, and I wanted to know, what exactly do they do? Whoa! Hello! I'm
Hey,
here with Mr. Maxime Robert from Mio Physio. Maxime, how you doing today?
I'm doing pretty good, pretty good. Thanks for having me today in your show. Do we call this a show or?
Well, it's more like a little talk because I'm curious. I want to know things about the human body. It's a great machine, and I'm looking for people to know how can we help
Yeah.
our health. My first question was, what do physiotherapists actually do, and why would someone call a physiotherapist?
Well, physical therapy is very diversified. Like if we look at what the physical therapist can do, it can treat amputee, it can treat the spinal cord injury, can treat burn victim, pediatric like disease, and geriatric problem like balance problem, or do they people can go back home and do their own stuff after going to the hospital, for example. And we treat neuromuscular injuries. That's a pretty tough one. Neuromuscular injuries. So we treat low back pain, we treat tendinosis, muscle strain, ligament sprain. So it's very diversified too in private clinic practice. So, well, if you have pain somewhere on your body, we can try to help you out. And if it doesn't fit with physical therapy treatment, we just refer to your doctor or to another specialist.
Do physiotherapists have specialties? I mean, does one maybe specialize with sports people, and another one maybe like you said with amputees, and another, or when you're a physiotherapist, are you a generalist and you can usually you read the whole body and you try to help him, or how
Well,
does it work?
well, straight from when you graduate, we're generalists. Like we learn like everything, but once you start working, you specialize with the where you work. And in private clinics, it's very diversified. As I said, I'm working since 2010. I'm probably not the best one to treat amputee because like they do that in a rehab center, and they're very
They're focused. They're a bit more focused on that and
yeah. I'm continually
up
learning
to
and trying
date.
to, yeah, up to date. And we have to do it because everything moves very fast. But and what we do here, it's more like I said, we're specialists like neuromuscular injuries.
Wow. So that's pretty interesting. What made you want to become a physiotherapist? Did when you were a little boy, did you already know you wanted to do that, or did you have someone in your entourage that did that and you said, I want to help people that way?
Well, two things. First of all, my mom was a physical therapist. She worked at the Hospital of Trois-Rivières in the traumatology department for years. So very young, I knew that physical therapy exists, but I didn't have any like pressure from her to become one. But
Good mom.
what I knew that she loved her work, and that was an inspiration for me. Like seeing her working every day with a smile and having fun, that was a very nice to see. And I'm a former hockey player. I played in the junior major hockey league, so I had to not to deal with physical therapy because I didn't have really like bad injuries, but I learned that there was what was to be a physical therapy for a team, like follow a team, a group of guy, and try to treat them all season long. So I kind of learned what it was like on the field. So
So
that was
you saw a sports therapist following your team.
yeah. Every year there was someone following us during game practice on the road. So I learned what was to treat people from the injury to the return to sport. So that was very interesting to see.
And I guess being a professional sports person, you get to think of your body a bit more as a machine and knowing that you need to take care of it and fix it. And having your mom also a physical therapist, you already had that background. You said
Yeah,
that she was happy in her work. What
yeah.
makes you happy? I mean, did you find the same the same yay in the work that you think you'd find?
I like to help people, so that's one of the first things you have to realize when you're physical therapy. You're there to help. We're not a magician, like we but we try to, like, we assess like functional problem, like can you walk, can you go up the stairs, like we find problems and we try to set goal and try help people to achieve it. So it's very grateful, it's very
Fulfilling?
yeah, absolutely. And that's what I like, helping other and let them help them to go back to work, sometimes go back to sport activity and just like daily routine, like
To get them to enjoy life again.
yeah, absolutely.
When you're helping someone, is it called exercise? Is it called adjustments? Is it called fixing? Is it called therapy?
It's called physical therapy, and we mix exercise, we mix advice, we mix manual therapy, massage, electrotherapy. Some physical therapy use dry needle,
Like
so
acupuncture, you mean?
kind of, yeah, it's the same needle, but it's not the same. They don't use it in the same way, like maybe they don't think the same way, so they don't use it the same way.
Okay.
But it's the same kind of needle. They use it to for muscle tightness. So I don't think we fix people, like people aren't broken. So we help them, and we as I said, we set goal, we assess what's going on, and we try to help them go back to what they love.
Yeah, I guess when you mean set goals, it's not automatically you feel like that, we're going to do that. I guess you need to read the person, I guess,
Yeah,
like according to already their age or how they already, their
yeah,
fitness.
because when we do, like the first time we see someone, like we talk a lot, like what's going on, what happened, like how old are you, what are you doing in your daily life, are you working, are you young young guy playing sport, are you very active, like who are you and what's the problem, what happened. And then we try to we won't treat everybody the same way. We're gonna try to set goal that's specific to you, and we try to help you reach it. Like it's not everybody who want to do a marathon or Ironman. Like some people just want to start, like I want to walk again, I want to do snowshoeing this winter. So we just try to fix goal that's very specific to you,
That you can realize that's why you said it a bit before. You talk a lot with people to know
yeah,
what do they want and
yeah.
to try to get them to that goal.
And we want to set like realistic goals. So we want to make sure that we can achieve it. And so depending of the injury, like some people can have goal that's too big for what they're like having right now,
Yeah.
and try to just make all this very realistic.
Should someone go and see a physical therapist if they're not in pain, or do we only go and see you when we're hurting? Would it be a good idea if we want to set goals? I want to become a marathon runner, but I feel fine. Would it be a good idea to go?
I think if you want to be a marathon runner and you feel fine, you better try to find a coach, like a running coach, kinesiologist.
Yeah, the movement.
Right. Yeah, exactly. They make they plan your training. You can try to find a nutritionist who can help you with what you're eating if you want to be like marathon runner.
Yeah. I understand, but my main question was: do we only go and see a physical therapist if we need to get better?
Mainly,
Okay.
yeah. We can help with advice and if we want to prevent injury. But still, our work is more when there's an injury.
Okay.
So when there's pain, when there's a functional limitation.
Physical therapists in English. In French, we would say physiotherapist, physiotherapist.
Yeah.
how do someone find one, and how do we choose a physiotherapist?
First of all, I think like friend referral, it's a pretty good option. So you have someone you know who met this person before, so it can help you a lot choosing a physical therapist that you will fit with.
Mm.
That's the first thing. Second thing, if a physical therapist is have some like technique, like very like an expertise in
Specific.
something, specific technique, I think this is gonna help. I have a colleague here who's treat vestibular problem, like people are dizzy, so he has some treatment technique for this, and he can assess it a good like can assess it the right way. So you have to look for those physical therapists.
As we said before, sometimes people specialized after a number of years. You discover that you specialized helping hockey players, or you discovered that you're helping people, like we said before, amputees, or
Yeah,
specialized in this or that.
absolutely. And for a private clinic, sometimes it can be convenient if it's close to home or close to work. So that can help to choosing a clinic.
Okay, where's your clinic?
Our clinic is at the Complexe Sportif Alphonse Desjardins, which is like a big sport complex that is close to Académie des Estacades. They have a sport études program. There are around like 600 young student athletes. So we have a lot of young sportive acute injury that we have to treat. But we treat a lot of adult people. We treat work injury, road injury. So we treat sport injury, but we see daily life injury too.
Do you think now, with everyone that has a cell phone and this and that, you're going to treat more neck injuries because people are going to be really looking down at their phones? And
maybe in a few years too, or a gamer with their
yes, the thumbs.
the thumbs. With working from home is very popular these days. So we do treat a lot of neck pain, thoracic pain in the last month. Like people start working from home. Sometimes they use the kitchen table to work. So I don't know, we have less sports injury, a little bit more work from home injury.
More everyday life injuries, yes. But that makes me think, does that mean that the people that go and see you, they have homework? I mean, they have to change things in their everyday life. It's not just they go and see you, you do a couple of helping adjustments, massage, replacing, and this and that. They have things to do or change in their life too.
Yeah, as I said, we give advice. So it can be how you stand when you work, and we give exercise too. Like we can do stretch exercises, mobility exercise, strength exercise. So we try to give some homework for people. We try not to give them too much. Like if we give like 10 exercise, sometimes it can be too much.
They won't do it.
Yeah, they won't do it. So we try to, as I said, we set goals and we try to have some specific exercise that people will feel that it helped them, and they're specific to what they want and specific to their problem. So
after you help someone, do they feel sore when they get back home? I mean, the next day, will they go, oh, I went for treatment, I went to help and to get help, and now I feel horrible?
That's not the main goal. Like we don't. That's not like we're not saying if you come and see me, I want you to feel bad for 2 days. That's not the main goal. But sometimes we try to adjust our treatment like to every person and every injury. So if the first time I see you, you tell me like I had like walking problem for 3 days, for sure next time I'll adjust what we do to make sure that I'm helping you, but I'm not giving you like 3 bad days. And it depends. Some pathology, we need to work a little harder. Like if it's joint stiffness, maybe it's going to be a little bit more pain. But if you already have low back pain, we try to to decrease the pain. We don't want you to feel bad for a week.
And I guess that's a passage that you need to go by if you want to eventually get to your goal of feeling better. It's okay to hurt a little bit.
Yeah, a little bit, but
it's your body fixing itself.
Yeah, but it's not always like no pain, no gain. It's not, as I said, we try to help. We try to use the right amount of treatment technique, exercises to make sure that you feel better in the next days.
Good. I'm trying to keep a good posture while I speak to you now. You made me conscious of the way I'm sitting on my chair. How does someone know they should go to a physical therapist, or how should someone, when their series of treatments are over, but they're like, oh, I'm not completely comfortable yet. Should they go back?
If you still have pain and it limits your functional capacities, I think you need help. And if this pain is there for more than 10, 14 days, I think you need help. Is it a physical therapist? Maybe. Is it your doctor? Is it medication, massage therapist, chiropractor? Like, if you don't feel that you're all right and it's go on like every day for a few days, I think you need help. Even if a physical therapy tells you your treatments are finished, maybe in a week or two, like, pain can come back. And you have to think, is it a little pain, big pain? Does it have functional limitations? And then I think you need help after like a week or two. If it's still there, if you're not happy with it, like, I think you can call back, call your doctor.
Good idea.
Help.
Good idea. Maxime Robert, the whole time you were speaking, you had a great smile. You seem to have a good vibe. You really seem to be loving what you do. So thanks for that. And if we want to find you, Maxime Robert from Mio Physio, next to Centre Alphonse Desjardins in Cap-de-la-Madeleine, Trois-Rivières. Is that right?
Absolutely.
All right. Have a super day. Thanks for taking time out for me.
Thank you for having me.